So, anyone can define contusion? कसैले पढेछ होला नि, मैले पढ त भनेको थिएँ. What do you mean by contusion?
Effusion of blood into tissues due to rupture of blood vessels.
Very good. के कारणले हुन्छ?
कुनै पनि त्यो मेकानिकल इन्जुरीहरू या त्यो अब्जेक्टहरूले हानेर त्यस्तो कुरा.
It's definitely due to mechanical injuries, but which kind of mechanical injury?
Blunt objects.
Blunt object. Yes, Shital, thank you so much for answering. You have answered what's required. All right. So contusion, which is also known as bruise, but I would prefer if you use this term contusion rather than bruise. All right. So you know what is contusion or bruise, where you can see bluish discoloration, color change in the skin, right? So it is characterized by infiltration of extravasated blood into the subcutaneous tissue. So which layer? It's in the subcutaneous tissue. Why does it occur? Due to rupture of the capillaries. How? By the application of blunt force. That completes the definition. Okay. So while defining, you have to include all these words so that it's a complete definition. Caused, characterized by bluish discoloration, characterized by infiltration of extravasated blood in the subcutaneous tissue, resulting due to rupture of capillaries due to the application of blunt force, is known to be contusion. Right? So there are other bluish discolorations in the body which can be confusing with contusion, like congestion, and there's one typical change that occurs after death that is known as postmodern hyperstasis, which is again bluish in color. And hypostasis is not due to any kind of injury, but it is due to the this gravity. A collection of blood occurs in the vessels, which is there. If it's there for a longer period of time, then on the dependent part of a body, you can see bluish discoloration, a bluish change in color. And that is postmortem hypostasis, which will be more clear while we read about postmortem changes. All right, so that is known as hypostasis of congestion. I don't have to explain you. I've read in pathology, so you know what is congestion. So you need to differentiate between these three conditions: contusion, hypostasis, and congestion, as it can be very confusing while doing postmortem examination. All right. Now there are various factors that influences the prominence of bruise. What are those, Pandakiri? First and foremost is amount of force. And the greater the amount, the larger will be the contusion. Right. So amount of force plays an important role. Peculiarity of the victim is the next factor that is very important. What do you mean by that? Peculiarity of the victim. Can anyone answer that? Yes, who was that? मैले भनेको बुझ्यो. Factors influencing the prominences of bruise, भनेको how certain factors influence the severity of bruise, भन्दाखेरि एउटा amount of force आयो, of course the greater the amount, more will be the bruise or contusion. What about peculiarity of the victim? Can anyone explain that?
Ma'am, is
child हो कि elderly हो कि adult हो कि त्यसमा पनि difference हुन्छ.
Okay, कसकोमा धेरै हुन्छ? Childrenमा हुन्छ कि adultsमा हुन्छ?
Children.
Or elderly?
Children.
two extreme ages ma huncha. Good. Anything else?
Ma'am, त्यो color को black हो कि white?
Let's not say black or white. Let's say if it's a fair-skinned person, or if it's a brown-colored person. All right. So, of course, the color of the skin also plays an important role. In a fair skin, it's more appreciable. Next, peculiarity of victim. Aru?
Gender, ma'am. Women are more tanny.
How gender plays an
Ma'am, त्यो anemic-हरु हुन्छ नि female-हरु.
female anemic huncha. Okay. Anything else?
More
Anemic huncha.
delicate tissue.
More
More delicate tissue.
delicate bhanna pani, there's more subcutaneous tissue in female rather than male. हैन त्यो कारणले गर्दाखेरि yes, gender plays an important role. And even if a person is fat, not related with gender, if a person is fat, then more confusion is present than if a person is muscular. Okay, त्यो पनि important. So peculiarities ma in around. Age plays an important role. Gender plays an important role, and type of body plays an important role, or even the skin color plays an important role. All right. Next is vascularity of an area. More vascular areas, such as in face and genital areas, it's more present. Contusion is more present. Resiliency of area. If area is resilient, then contusion is less. So resiliency depends on the muscularity. So this is how contusion looks like. This is an extensive bruising of a face due to hitting, kicking, and stamping. 6 days earlier, this victim has multiple fracture of facial bones. There is one peculiarity of contusion known as deep, delayed, or migratory bruise. It's all same, all right? It's deep, takes a longer time to appear, and it's against the actual point of impact. For example, if there is impact in the forehead, or if there is any kind of fracture in the frontal bone or in the anterior clinoid fossa or orbital region, still you can see contusion over the below the eye. All right. So this is against if it's not the contusion does not appear at the point of impact, but it is somewhat away from the actual point of impact. Why does it occur? Because there is blood escaping from a damaged vessel tract along the facial or muscular planes. And very common example for migratory bruise is black eye. Very important. Please go through this, all right? Another important peculiarity of contusion is more than abrasion, healing pattern determines the age of bruise or contusion. All right. This is more reliable than abrasion. All right. So this is very important. Fresh, it's reddish in color. Few hours, it becomes bluish in color. Second day, bluish purple. Third day, bluish black. Fourth and fifth day, due to presence of hemosiderin, it's brownish in color. Fifth to sixth, seventh day, due to presence of hematidin, it's greenish in color. 7th to 10th day, due to presence of bilirubin, it becomes yellow, and slowly after 2 weeks, it fades away. Now, healing of contusion, I would like to ask you one question. Does it heal from center to periphery or periphery to center? You must have read in pathology. Center to periphery huncha ki periphery to center huncha?
Periphery to center.
सुनेन कति भयो?
Periphery to center.
Periphery to center? You sure? Okay, if you have had contusion, you would notice that as the time passes on, the contusion size will increase because it's always the healing is from center to periphery. This will diffuse virus. Right? So don't forget that. Important Viva question. It always heals from center to periphery. Right? Well, we talked about this patent abrasion one. You picture. It's a patent abrasion and contusion where you can see the mirror basic shape of the impacting object. Okay, you might be in exams, you might be shown pictures and you might be asked about the causative weapon. All right, you picture what is the causative weapon money. You can say, basically this person was beaten with a crutch, but you cannot say ye picture maybe you can say crutch, but again that is not how you answer. You just give कुनै पनि disease को differentiate diagnosis दिएको जस्तै you can give opinion with different opinion जस्तै crutch हुन सक्छ, whip हुन सक्छ, any kind of stick हुन सक्छ हैन. So don't just say crutch or stick was used or rope was used भनेर त्यसरी भन्ने हैन, whip was used भन्ने हैन. You give variety. यो पनि हुन सक्छ, यो पनि these weapon may be possible, but sharp force injury is not possible in this condition, right? Because here you can see patent abrasion and contusion. All right, that is how you answer. तिमीहरुको OSCE मा पनि सोध्न सक्छ र viva मा पनि सोध्न सक्छ. So whenever you are studying, please go through the pictures. Try to find books where you can see lots of pictures. हाम्रो library मा पनि छ. There's a depth and deduction where you can see nice pictures, and those cases were, and those cases happened in Nepal. Nepalko cases haru pani cha tesma. त्यही कारणले गर्दाखेरि go through that book. Theory ko लागि अरु book refer गरे पनि go through that book and try to find pictures and study as far as possible. All right. And fabricated injury, we know about fabricated injury with a view of supporting false charges. Some irritant substances can be used for contusion, all right, for contusion. These appear like bruises, but are dark brown in color, color with margins covered with vesicles. Now, how can you differentiate between true contusion and false contusion? Another important question is, if you see with the magnifying glass, you can see some vesicles in the margins. Okay, so that is how we can differentiate between fabricated wound and true contusions. Patent bruising, a design of the weapon may be imprinted in the skin. There's another type of bruising known as abrasion types of abrasion. So these are not types of bruising, but these are peculiar type of bruising. यस्तो किसिमको bruising हुन सक्छ, migratory bruising हुन सक्छ, railway line bruising हुन सक्छ. Okay, so this is known to be railway line bruising because you can see two parallel lines out here, and in the middle you can see that there is normal tissue, right? So this usually occurs in case of a person, if person is hit by the rod, stick or whip, produces two parallel lines. Okay, why does it occur? Because in the center it compresses the vessels so they do not bleed, but there is rupture at the margins. All right, so this is known as railway line bruising or tram line bruising. Please mark that, right? Don't get confused. Railway line bruising or tram line bruising, where you can see two parallel lines. The medical legal importance of bruising, we'll finish up to contusion, then next class we'll continue with laceration. Okay, and please do read about laceration and sharp force injury while coming to class next Wednesday. And bruise or patent bruise, evidence of application of blunt force. But if there is bruise, blunt force, it's easy. Contusion of a particular part of a body indicative of peculiar evidence, or abrasions. If bruises are present or in a form of nail marks or bite marks on neck, breast, and inner side of the thigh, it indicates sexual assault. accidental or homicidal, it cannot be suicidal in nature. So medical legal nature of bruising can be either accidental or homicidal. Suicidal, very less possible. Blunt force injury, but suicide is very less possible. Time of assault, if it's antemortem in origin or postmortem pani थाहा पाउन सक्छौं, and pattern of healing ले पनि we can know the age of bruising. अब यहाँसम्म कसैलाई केही नबुझेको छ भने please raise your questions. Otherwise, we are signing off. Okay. कतिजना त गइ पनि सक्यो छैन, so should I? No, okay, good. Please go through what we have studied today and next chapter को लागि पनि हैन, sharp force injury सम्म चाहिँ पढ at least, है? All right, so have a nice weekend. Goodbye.
Thank you, ma'am. Bye-bye.
Thank you, ma'am.